I actually have been in client meetings all this week, and believe it or not, three couples that we talked to who recently were on cruises came back with COVID, came home with COVID. I'm so blessed or lucky or surprised that they were able to get home. And so it made me kind of wonder. I know we're anxious to get out and to travel again, but it made me wonder, what are people that have recently had COVID or have had it over the last 3 years? What are they experiencing? And I found the effects of long COVID surprising. So, to top it off, the New Yorker magazine came out, and I don't know if you can see that, but on the floor it says Sweeping of the Masks, and the title of the cover is called Fall Sweep. And as you saw, amongst the leaves were COVID masks. And quite frankly, I was just in New York City, and that is very, very true. So we may be getting a little lazy or comfortable or what, tired. And so let's talk about what's really the reality out there for many. So, new data from the Household Pulse survey shows that of more than 40% of adults in the United States who have had COVID, nearly 1 in 5 of those are currently or still have symptoms of long COVID, which means roughly about 1 in 13 adults in the US, or 7.5%, have long COVID symptoms. This is nearly 3 times higher in adults ages 50 to 59 who currently have long COVID than those ages 80 and older. And how many of the millions of Americans who have now tested positive for the virus are facing long term issues caused by their infection? Here are some facts about long COVID. A symptom list includes heart, lung, kidney, gastrointestinal problems, pain, fatigue, loss of smell or taste, mental health issues, depression, anxiety, and more in the months following the infection. Post COVID conditions are found more often in people who had, of course, severe COVID illnesses, but anyone who has been infected with the virus that causes COVID can experience these long COVID symptoms. Even people who had mild illnesses or no symptoms from COVID at all. So, people who have not been vaccinated and become infected might also be at a much, much higher risk of developing this post long COVID infection compared to people who, of course, have been vaccinated or had breakthrough infections. Among seniors 65 years and older, the researchers warned they were at increased risk from mood disorders, or what they call brain fog, uh, to, in fact, substance abuse. So people are becoming affected by this in a significant way. So, what are the prevention methods? Well, we've heard a lot about this, and not a lot has changed. But one of the things that may be important, first, the Minnesota Department of Health recommends checking the CDC by county tool to see what is happening in your area where you live, because your area may have concentrated amounts of COVID or variants of COVID that may make you more accessible to receiving the virus, particularly cruise ships. So, if you, of course, are immunocompromised or at a higher risk of severe disease from COVID, the CDC gives more protective recommendations for you. If you test positive and at a high risk, right away, about follow up with your healthcare practitioner about eligibility for treatment, because there may be different things that are available to us now that we're 3 years in, that your healthcare provider may be aware of as the ongoing changes of the variants of the virus. Obviously, gathering indoors and various other things. It's so easy to think that we're on the other side and we're resilient and we can't wait and we're kind of in this lull of tiredness around it. But I would encourage you to be vigilant. The three couples that we talked to this week are doing fine. However, the fact that they went on these cruises and ended up with COVID, they're not happy. And many of them do, a few of them may have, as a matter of fact, two said that they feel like they have the long COVID symptoms. So I just suggest be prepared, don't get too lax, pay attention, and as we go into the winter months, particularly in more crowded venues, take protective measures. It's about working together in our community to keep each other safe and stay aware of the long term effects of COVID. And we still have no answers, but it is surprising the size of the percentage that are experiencing symptoms of long COVID. So stay safe and take care of each other. And I appreciate your time. If this is something that you think is helpful or valuable, please share it with someone else. And thank you.